It's actually taking back a few years. I had some cause which made me to search up the doctor. And in Sweden, I mean, we don't have the traffic jams as you do here, but still it's a kind of hard to get in contact with the primary healthcare. They're doing more things because they are online all the time. We are busy all the time, so this has to be more convenient. It has to be more convenient way to find out and see a doctor, ask a doctor, and find out about my problems or my family's problems in an easy way. So that was the first came to me when I was thinking about DocOnline. Secondly, I'm traveling a lot. I'm traveling all over the world. So that was the start of this. And so we thought of launching this in Sweden. This is a service which we thought could be really good in Sweden and Europe itself. But then we started to do and then we looked a few years ahead, which will show us how will the online presence be in a few years ahead. So was a pretty big difference because, I mean, the increase in Europe is not increasing that much. In US, not. In Latin America, okay. And in China, very good. But in India, it was tremendously. You also have a very good economy right now. So it's for the companies here and people here are doing better and better. And the online presence just increased all the time. The smartphones increasing all the time. We have been, the last decade, created many software services like this. But we are able to run this company for many years ahead just with our own money. DocOnline. This is the medical treatment as of today. You have a sickness or you have a question, you go to a hospital, you get a prescription, you go to the pharmacy, you pick up the medication, you go to a lab test, you do the test, you go home, you get the report, you're going back to the doctor for a second meeting again. That's the traditional. But what is the problem that we see today? We see getting to a hospital. Getting to a hospital is hard, but getting to a hospital here in India is even harder with the traffic jams. The pressure on the primary care as of today. It's a lot of people that goes to the hospital. It's long queuing. It takes time to meet the doctor. And just imagine when you go there for the second time or the third time, there's a lot of hours that you will spend there. Google. I use Google every day for a lot of things, but not for looking at my kind of symptoms, because everything is very bad. So we shouldn't trust Google in that one. So that is the problem. So healthcare with DocOnline then. It's all about the interaction between the doctor. As Raoul mentioned, we can do that by online, by landline, or by chatting with the doctor. You can get prescription, you can do lab tests, you can buy prescriptions or medicines right in the app. And you get all these things home delivered. So you can do this in your convenient home, not going outside. DocOnline can get you help anywhere, anytime, anyhow, at your convenience. 6 days a week, 12 hours a day, we open for you. When we give a peace of mind for you and your family, because you can always interact with the doctor by chatting with the doctor and ask them questions and get relevant, valid answers back. And you can get healthcare on your schedules because you can plan, you can do appointments, which I will show you as well. And you can get the prescription home delivered without interacting with anybody else. So you can do that within the app. So our future plan. As Raoul mentioned, number one, it's already done. We launched here in July this summer. We already right now got 15,000 paying subscribers. We got that within 3 months, and it's corporate users. And they so far very, very happy and have given us a lot of feedback, which we have implemented. Secondly, we just now open our branch office, which will be in Pune. We did it this week. So we're covering that state as well. And we're going to launch in many other states by next year. The third one is going internationally. So we are planning to already next year go international. Which countries, which areas, is not we can't reveal right now. But still, we will do this with all the models that we've been using before and done in our previous companies successfully.